Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I woke up bright and early thinking, I'm just going to tell you to put pep in your step and, let's get the job done. And then a few minutes ago, I just had something happen that kind of just kicked me in the gut. And it was like, geez, why do I fight so hard? But then a second later, someone helped me get something done that truly blessed me. So I'm going to say again, put pep in your step. Don't let one person or one situation get you down, because together we can do good things. A couple of things I wanted to share with you. Again, you know that CMS recently released the proposed rules that changes what President Trump did for consumers regarding short-term medical. What we need to do is, number one, sign the petition that I sent, share the petition, get as many signatures as you can, comment, easy, follow the Federal Register, click on the comments, and send a letter and talk about how the federal government doesn't need to make decisions for consumers. Short-term medical, even if you do not sell it, you still should act. It doesn't fit everyone's needs, but it does fit some folks' needs, and it shouldn't be changed, and they shouldn't be hurt by these proposed rules. So absolutely sign the petition, takes a second. Send a comment letter, doesn't have to be long. I will be going to Washington, D.C. on August 15th and 16th. If anyone would like to go with me, please let me know. My flight is made. I'm going. I will be there. I've already started making appointments. The senators in Congress, congressional offices will be in their districts. So I will be meeting with health policy people, which is fine. They're the ones that brings these important messages to their bosses, but I'm absolutely trying to get them to act now before I get there. So I will be there. If you want to go, you let me know. Very important for you to take a second, go to the website, click on Find an Expert, and make sure that your information is correct. If you're congressional, your listing is under your city and state. If you're senatorial or presidential, we'll list your information under every state that you're licensed. Now, full disclosure, I'm a one-person office, one-lady office. Do I make mistakes? Absolutely. Am I perfect? No way. Am I doing the best I can? I promise you I am. But if you wouldn't mind doing that, that would be great. Don't forget about the Agent Summit. That will be here before you know it. I'm doing the final touches. My office is full of signs and awards and everything that you can imagine that goes into putting a summit together. It's a lot of work, but I really, really love it. And this is going to be one of the best ones ever. Just for example, there's going to be a presentation on an attestment that needs to be signed by your employer clients. Did you know that? Have you heard that? Has it been on your radar? It wasn't on my radar until I read the description of one of our speakers' presentations. It's important. You need to know that. Consent form. We're going to have speakers talking about the consent form. Absolutely, you need to know that. We're going to have amazing sponsors. I can't put another table in our room. We have so many sponsors that are going to be there. So it's going to be a lot of fun. It's going to be a lot of education. We've filed CE for the states that have at least 5 folks coming from your state. So that's been filed. Working on that. A lot of good things happening. A couple of things I want to share with you in the Monday morning news. The Wagner Law has said that the U.S. Court of Appeals from the 8th Circuit has ruled that a group health plan does not have to cover emergency services specifically excluded by the plan document. So what happened is a person had Bariatric surgery, not covered by the plan, ends up having stomach pains, nausea, and goes to the ER, and that would not be covered because the bariatric surgery was not there. But you can read the information about that. Very interesting, and something that you need to know if you sell in the employer market. Very interesting fact, and we probably knew this, but the CDC data says that Medicaid beneficiaries visit the ER more frequently than any other individual, including private insurance, Medicare, or the uninsured. So you can imagine the cost behind that. Now, another big CMS proposed rule that's causing some havoc, and I can't wait to talk to Senator Cassidy about this one. But CMS proposes payment cuts in physician fee schedules, and it says the doctors are crying foul. Please read this article. Jesus. Does it get more crazier? Does it get more crazier? Another thing that we need to have our eye on the ball. If you work in the individual market, plan year 2024, CMS has the training for returning agents and brokers. It's going to be July 27th, Thursday, 1:30 p.m. to 3:00 p.m. Eastern Standard Time. So you want to pay attention if you're not in Eastern, whether you're Central, Pacific, or Mountain. You definitely want to pay attention, and you want to tend to check out any changes. Now, know that Dean Mose and Madeline Pellish will be at the HAFA Agent Summit answering a lot of questions about what's going to be new, what are the changes in the Marketplace 2024. Now, lastly, I'd like to share a couple of things about if you're licensed in Louisiana. The Commissioner of Insurance has issued a notice of a public hearing regarding Blue Cross Blue Shield being sold to Elevance Anthem. It's going to be August 21st and 22nd. Anyone can attend. If you'd like to submit any comments, it gives you the instructions on how to submit comments. And then the commissioner also released a news release talking about people that file complaints, and in the health section, which is us, there was 385 complaints filed, and they said funds recovered was 147,326. So interesting if you work in the Louisiana market. But put pep in your step. Stop right now. Sign that petition. Share the petition. Get your people in your office. Get people, your clients. Get everyone to sign the petition. We want to bring that petition with us to DC along with our comment letter. I think that's important to show those on the Hill how important this is, not to us, because this affects consumers. It affects what people can buy, especially those that cannot get a tax credit, and their premium is going to be $1,500 to $2,000 a month, and it's not affordable, and they are healthy, so they can buy a short-term medical. Why should their plan be reduced to 4 months? Why? What's the reasoning? What's CMS protecting them from? Decisions that they need, medical benefits that they need. I think they're going down the wrong path. Realize that those proposed rules also talk about MEC plans, and they talk about limited benefits. So you want to pay attention to all of the things that are involved in the comment letter. So I think I'm feeling a little bit better. I'm a little chipper than I was about 10 minutes ago, but I love all of y'all. I am proud and honored to represent the HAFA Freedom Fighters, the cream of the crop, the best of the best, the ninja warriors that fight like hell. Have a great day, and until I see you next week.